Do you get a lot of pain or tension right at the corner of your neck and shoulder right here? Or do you feel like you get a lot of tension headaches, especially when you're working at a desk for long periods of time? If so, then tight upper trap muscles may be your problem. In today's video, I'm going to take your tight upper traps through my proven functional mobility formula, where I'm not just going to teach you how to stretch this muscle, but also restore some joint range of motion and also strengthen the tissue so we can hold on to those changes for long periods of time. So let's dive right in. So there's 4 R's in the functional mobility formula, and that first R stands for recognize. So first we want to recognize where our symptoms are. If it's upper trap, usually it's going to be right in the corner of the neck. It can even go right up until the base of the skull here. That's the first part, to understand where your symptoms are. But the second part of recognize is recognize a couple baseline movements that we can test after we're done with this routine. So when it comes to tight upper traps, a lot of times you'll have limited range of motion in your neck, and especially feel a tug when going away from that muscle or side bending away. But you can even feel that tension when looking down or even looking up towards the ceiling. So first, check your neck ranges of motion and see if there's a couple of those tests that provoke your symptoms. Once we've recognized where our symptoms are and we spotted those baseline tests, we're ready for our first movement. So the second R is to reduce tension. So I'm going to show you how to release or relax those tight upper traps. So let's say my tension's on my left side, sitting at a bench or a chair at home. You're first going to grab onto the edge of the bench or chair, and then you're going to lean away until you feel a stretch through the arm, and you're going to tilt away, and I already feel some tension in my traps right here. And to take it to the next level, what you do is go over the top with your opposite hand, and then try to pull further into that stretch, and I already feel a ton of resistance here. Now, if you don't feel a ton of tension yet, to take it up to the final level, you're going to tilt your head up towards the ceiling. Oh, and I feel a big pinpoint stretch right at the corner of my neck here. So level 1 here would just be holding this stretch for a good 30 to 45 seconds, but I'm going to show you a hack to make this release a lot quicker. So when you're here, what I'm going to do is actively pull down as I push my head up into my hand with about 20% of my max effort. So we're going to get a nice isometric contraction here, and I'm going to count to about 7-10 seconds if it's really tight. And then after I get that isometric contraction, I'm going to kind of relax, shake it off, and then see if I can go further, which I can. And then I'm going to simply repeat for another round here. So I'm going to push up and pull down with about 30% of my max effort now. So we're going to take it up to another level, really feel that enhanced stretch right in that upper trap. And then after that 10 seconds or so, relax, and then see if I can go further. Most of you will feel a lot of relaxation after 2 rounds, but if it's super tight, you can do 3, even 4 rounds, and it should take less than 60 seconds to totally relax this muscle. And since you're already at it, we might as well do the other side, especially if both sides are tight. Grab onto the edge, lean away, tilt away, over the top, pull, look up, pull down, and then I'm going to resist that force in my hand with about 20% of my max effort. 3, 2, 1, relax, pull further, which I can, and then we're just going to repeat for another round of 10 seconds here. And each time I try to ramp up that intensity, so I'm about 30% of my max effort. 3, 2, 1, relax, pull further, and then come back up. Wow, does my neck already feel loosey-goosey? But that's only the first move. Now the third R stands for restore. So we're going to restore the joint range of motion right in this area of our spine. I'm going to show you one of my all-time favorite moves, especially if you're a desk worker out there. So to restore that movement, we're going to do some retraction and extensions. So I'll show it from the front first. I'm going to sit up nice and tall like someone's pulling me from a string. We're going to go chin in or chin tuck until I feel a little bit of a stretch on the back side of my neck. And that's level 1. If you're feeling any pinching or poking in your upper trap, then just stick with level 1 if that's all you can handle. But level 2 would be chin tuck until I feel that tension or I run out of real estate. And then I'm going to tilt my head up towards the ceiling until I feel either a stretch at the base of my neck right here, or I feel like a pinching sensation, or it provokes my symptoms. So I'm going to do a solid 10 to 15 reps here, seeing if I can go further and further with each rep. So from the side view, if I'm slouched here, I'm going to sit up nice and tall like someone's pulling me from a string, chin towards the back of my throat, which is going to grow my spine long, and then I'm going to slowly start to look up towards the ceiling here until I feel a little bit of tension. I touch that tension and come right back, And then as you rep this out, you want to see if you can start to go further into that range without it either provoking your symptoms or feeling a big old spot of tension or even a pinching sensation. And if you don't feel much with this movement, then there is a third level. So we go chin tuck, look up, give me prayer hands, and then you're gonna push further into that range, really feeling a big old stretch through the base of the neck and that upper back area. So the fourth and final R stands for reinforce. So we're going to reinforce the changes we just made with a strength and stability exercise. Now, when it comes to the upper trap, actually, in most people, it's over-facilitated, which means it's overactive. So I'm going to show you an exercise that's going to activate more of that middle and lower trap to try to turn off that hyperactivity. So from this quadruped position, you're going to drop down to your forearms, making a diamond with your fingers here, and that diamond's going to be right around forehead level. And I'm going to span my elbows out at about a 45-degree angle. Now from here, I'm going to shrug up and then shrug down, really set those shoulders. And then a lot of times, people will actually feel that activation just when they kind of push into the ground. So this would be level one, just trying to feel that shoulder girdle stability. But most of you will be able to turn it up to the next level. So the next level would be doing a slight chin retraction so we can get more of that deep neck flexion. And then we're going to drive through our toes to come up into what we call a low bear position. So we could hold this for a plank, say for a good 20 to 30 seconds. And I feel a lot of the activation between my shoulder blades and a little bit in my lower trap area. But if holding a plank is too much, then you can slowly come down to the ground, kind of reset, shrug up, shrug down, and then drive through the toes, feeling like someone's pulling my butt by a string here, load through the shoulder girdle, and then bring it back down. So there's two ways we could do this. Holding it, which is a little bit tougher, especially if you're not used to this, or you can get dynamic and just rep this out for a good, probably 5 to 6. This is a lot harder than it looks, especially if you take your time doing like a 3-second count on the way up, and then a 3 to 5-second count on the way down. Whew. Whew. Just after doing a couple reps there, I'm not only winded, but I feel the middle of my shoulder blade area working, and I feel way less tension in my upper traps now, because we tried to turn down the facilitation there and turn it up in the other areas of that trap muscle. Now there is one more bonus R, and that bonus R stands for reassess. So how do we know if this routine is good for you? Well, remember, we recognized a couple things at the beginning. First, where are our symptoms? So if you had a lot of tension or pain right in this upper trap or corner of the neck area, did that volume knob go down after doing this routine? If so, great, then you know this routine is good for you. But we also want to reassess our baseline movements. So for instance, if I had a lot of tension here, especially when rotating or tilting away from that side, can I go there smoother without that tension? Or can I look down and up without feeling any pain, pinching, or poking in this area? If yes, then you know this is a really good routine for you. Even if it didn't turn your symptoms down, if it improved your function, then that means you could do more of your everyday task without poking your pain alarm. And over time, if you improve that function and you set your pain alarm off less, then eventually that symptom knob's gonna go down and you're gonna be feeling great each and every day, especially if you're one of my desk workers. If this functional mobility formula makes sense to you, this is how I rehab every single one of my patients in the clinic, regardless of what muscle, joint, or nerve issue they might have going on. So if you have a suggestion for a body area you wanna see next, leave it in the comments below and I'll make sure to add it to the docket. Keep it moving, y'all.